In this video tutorial, I am going to discuss the clinical significance of serum enzyme measurements. These serum enzyme measurement tests are very important diagnostic tools in modern medicine. In addition to this, they also help us to assess the severity and prognosis of the diseases. Prognosis means whether a patient is improving or deteriorating. Now, there are many clinically important enzymes, and covering all the enzymes in a very detailed way is not possible in this single video. So here is what I will do in this video. First, instead of covering all enzymes, I will cover only common, frequently encountered serum enzymes in the clinical practice. And second, instead of covering each enzyme in a very detailed way, I will cover only essential points so that you can get a foundational overview. However, if you want an in-depth coverage of any specific enzyme, mention it in the comments below and I will create a detailed video on that topic. So without further delay, let's dive into the topic. Let's first make a list of serum enzymes which are more or most frequently encountered in the clinical practice. So in this list, we have alkaline phosphatase, creatine kinase, lactate dehydrogenase, aspartate aminotransferase, alanine aminotransferase, amylase, lipase, acid phosphatase, gamma glutamyl transferase, 5' nucleotidase, and pseudocholinesterase. Now, in this list, the first three enzymes have already been covered in the previous videos. Those videos are available in the same enzyme playlist, and I had also put their links in the video description below. So let's begin our discussion with the fourth enzyme, aspartate aminotransferase. Aspartate aminotransferase, this is commonly abbreviated as AST. It was previously known by the older name serum glutamic oxaloacetic transaminase or SGOT, though AST is now the preferred medical terminology. The normal range of serum aspartate aminotransferase activity is 5 to 40 units per liter. Aspartate aminotransferase is primarily synthesized and remains stored in the cells of heart, liver, and skeletal muscle. So, if any of this tissue is diseased or damaged, it leads to release of aspartate aminotransferase from the cells to the serum, leading to increased serum aspartate aminotransferase activity. So, the heart disease like myocardial infarction, commonly known as heart attack, and congestive cardiac failure, liver disease like acute hepatitis, chronic liver diseases, and skeletal muscle damage like vigorous exercise, electric shock, and muscular dystrophies. In all of these conditions, serum AST activity increases. In this list, this congestive cardiac failure is little bit unique because here cardiac cells are damaged, which releases aspartate aminotransferase in the serum. In addition to this, cardiac failure leads to liver congestion. So liver cells also get damaged, which further releases aspartate aminotransferase in the serum. So in congestive cardiac failure, serum aspartate aminotransferase activity is increased because of contribution by not only cardiac cells, but also contribution by the liver cells. Now, the next enzyme to discuss is alanine aminotransferase or ALT. Its older name is serum glutamic pyruvic transaminase or simply SGPT. The normal range of serum alanine aminotransferase activity is 5 to 35 units per liter. Just like aspartate aminotransferase, alanine aminotransferase is also synthesized and remains stored in the cells of the same three tissue: heart, liver, and muscle. However, the liver contains by far the highest activity of alanine aminotransferase, while the heart and muscle holds very minimal activity. So for all practical clinical purposes, we can consider alanine aminotransferase to be a liver specific. Therefore, any damage or disease of liver leads to increased serum alanine aminotransferase activity. Such liver disease could be acute hepatitis, chronic liver diseases like cirrhosis of liver or hepatic malignancy. And then, once again, there is a congestive cardiac failure here. Here, the mechanism is identical to what we discussed with the aspartate aminotransferase. Cardiac failure leads to liver congestion. So, liver cells also get damaged, and this liver cells releases alanine aminotransferase in the serum. So here what happened? Root cause is cardiac, But the enzyme elevation reflects a secondary liver involvement, not the primary heart damage, right? So now next enzyme on the list is amylase. The normal serum amylase activity is 31 to 107 units per liter. Amylase is primarily synthesized and stored in the cells of two organs, the pancreas and the salivary gland. So, if any of the tissue is diseased or damaged, it leads to release of amylase from the cells to the serum, leading to increased serum amylase activity. Pancreatic disease includes acute pancreatitis and pancreatic carcinoma. In addition to this, we can also include perforated peptic ulcer here. Why? Because perforation leads to release of acidic gastric content near to the pancreas, so pancreas also becomes inflamed. Similarly, in case of acute cholecystitis also, the nearby pancreas is also inflamed. Now, a salivary gland disease. A classic example is parotitis, which is inflammation of the parotid gland, and it is most commonly seen in mumps. There is one more unique and clinically important cause of elevated serum amylase activity, and that is renal failure. See, normally the kidneys clear amylase from the serum, but in renal failure, kidneys cannot excrete amylase, and this leads to accumulation and increased serum amylase activity. Now let's discuss a lipase. This enzyme is closely related to amylase. The normal range of serum lipase activity is 0 to 45 units per liter. Lipase is primarily synthesized and stored in the cells of pancreas only. So, in case of pancreatic disorders only, serum lipase activity is increased. So, we can consider lipase to be highly specific for pancreatic disorders. You can compare this with the amylase. Serum amylase activity increases in pancreatic as well as salivary gland disorders, whereas serum lipase activity is increased in pancreatic disorders only. By using this information, you can easily differentiate between pancreatic and salivary disorders. Next, we discuss acid phosphatase, often abbreviated as SCP. The normal range of serum acid phosphatase activity is 2 to 12 units per liter. This enzyme is primarily synthesized and stored in the cells of two organs, the prostate gland and the bone. Remember, only osteoclast of the bone contains this enzyme. So, if any of this tissue is diseased or damaged, it leads to release of acid phosphatase from the cells to the serum, leading to increased serum acid phosphatase activity. Prostatic disorders mainly include prostate cancer and bone disorders, specifically the conditions involving increased osteoclast activity such as Paget's disease, osteoclastoma, and bone metastasis. This bone metastasis means cancer that have spread to the bone. Now there is one important aspect in case of acid phosphatase, that there are different isoenzymes of acid phosphatase. The prostatic isoenzyme is tartrate sensitive, while the bone isoenzyme is tartrate resistant. This property allows laboratories to differentiate the tissue source of the elevation, which is extremely useful clinically. And by the way, for prostate cancer, serum acid phosphatase is not a sensitive marker. So, increased serum acid phosphatase is found only in advanced stage of prostate cancer. So, we cannot use it for the early diagnosis of prostate cancer. But luckily, we have another lab test, that is serum prostate specific antigen or PSA, which can detect prostate cancer in very early stage. But remember, prostate specific antigen is not an enzyme. I had mentioned it over here just to show you that enzymes are not always the best marker. There can be other better alternative lab test also. Now, the next enzyme to discuss is gamma glutamyl transferase or GGT. The normal range of serum gamma glutamyl transferase activity is 10 to 50 units per liter. Gamma glutamyl transferase is synthesized and stored in the cells of kidney, liver, pancreas, and intestine. Remember that highest amount of this enzyme is found in the kidneys, followed by liver, then pancreas, and then intestine. But the gamma glutamyl transferase activity of serum is mainly derived from the liver, not from the kidney. Within the liver cells, gamma-glutamyl transferase is localized on the cell membrane of hepatocytes and specifically on that part of cell membrane which is adjacent to the biliary canaliculi. So this makes it an excellent marker for hepatobiliary diseases. So serum gamma-glutamyl transferase activity rises in which condition? In any this hepatobiliary disease like obstructive jaundice, hepatitis, and chronic alcoholic liver diseases. Next, we have 5' nucleotidase or 5' anti. The normal range of serum 5' nucleotidase activity is 2 to 10 units per liter. This enzyme is present in the liver, so increased serum 5' nucleotidase activity is found in liver disease characterized by cholestasis. Cholestasis means impaired bile flow. And finally, the last enzyme on the list is pseudocholinesterase, and this is the most unique enzyme of this entire video. Now, to understand its uniqueness, let's revisit our list of enzymes. Now, all enzymes in this list except this pseudocholinesterase are plasma non-functional enzymes, whereas pseudocholinesterase is plasma functional enzyme. Now, as we talked in the previous video, plasma non-functional enzymes are synthesized by the cells but not secreted in plasma as they have no any biological function in the plasma. So these enzymes remain stored in the cells. So obviously cells are rich in such enzymes. So whenever the tissue is damaged, cells will break open and content of the cells which are rich in plasma non-functional enzymes are poured into the plasma. So in case of respective tissue or cell damage, such enzyme activity in serum increases. Pseudocholinesterase is different. It is a plasma functional enzyme, meaning it is synthesized by the cells and then actively secreted into the plasma to perform its function directly in the plasma. It does not remain stored in the cells. So obviously cell itself contains less level of such enzymes. So whenever respective tissue or cells are damaged, plasma level of plasma functional enzymes is not increased, rather it decreases as its synthesizing cells are damaged. Can you see the difference? Whenever respective cells are damaged or diseased, the level of plasma functional enzyme is decreased, whereas the level of plasma non-functional enzyme is increased. This characteristic makes pseudocholinesterase the most unique enzyme of this list. Now let's go back to the pseudocholinesterase. So, what's the normal range of serum pseudocholinesterase activity? Since this enzyme is actively secreted into the bloodstream, its normal level in serum is actually quite high, around 4,000 to 12,000 units per liter. It's mainly produced by the liver and continuously released into the blood. So, in liver disease like cirrhosis, where the liver cells are not functioning properly, the serum pseudocholinesterase activity decreases. But there is one twist in the story. This enzyme is not mainly used to diagnose liver disease. It actually has two very special clinical uses. The first is detecting organophosphate poisoning, and second is in pre-anesthetic screening for atypical pseudocholinesterase. Let's understand one by one. Organophosphate compound, which is commonly found in certain insecticides, inhibit this enzyme that is pseudocholinesterase. So if someone is exposed to this toxin, their serum pseudocholinesterase activity is reduced drastically, and such very low activity becomes an important clue for diagnosing organophosphate poisoning. Now, in this pre-anesthetic screening for atypical pseudocholinesterase, what happens? Some people have genetic variant that makes a version of this enzyme with very low activity. Such variant enzyme is known as atypical pseudocholinesterase, and such person will have mostly normal life. If such person has a normal life, then why is that a problem? The problem occurs when this person needs to undergo anesthesia. Because during anesthesia, to do some operative procedures, muscle relaxant drugs like succinylcholine and mivacurium needs to be administered to the patient. These muscle relaxant drugs are actually a very dangerous drugs because it literally induces paralysis. But in normal person, these drugs are quickly metabolized by normal fast-acting pseudocholinesterase and its paralytic effect quickly reversed. But in a person having a slower acting atypical pseudocholinesterase, these drugs are not quickly metabolized. So paralysis can last much longer than expected, which can even lead to dangerous prolonged apnea. And that is the reason that pseudocholinesterase activity is measured before anesthesia, especially when these drugs might be used. It actually helps anesthesiologist in choosing the safest muscle relaxant in proper dose. So this concludes our overview of most clinically significant serum enzymes. I hope that all the concepts are clear. If you have any query or confusion, please write it down in the comment section below. Thank you.